All right, so let's discuss and revise the upper limb. Okay, so for today, we'll be focusing on the landmarks and the regions of the upper limb. So I'll be focusing on the landmarks and the regions of the upper limb. All right. So you have to try and bring back your memory on that. So for the landmarks, we have these ones: the cubital fossa, the anatomical snuff box, the carpal tunnel, the axilla, and the pectoral region. So for the axilla and pectoral regions, those are basically regions. Then the first three are the landmarks that I'll be looking at. All right. So anyway, relax. Now let's jump straight into the axillary region. You understand that the axilla is a region that we find that is taking you from the posterior neck, right? Taking you from the posterior neck to the brachium, all right? So it's basically taking you from the posterior neck to the brachium, all right? So it's basically pyramidal in shape with a base, the walls, and an apex. So the apex of the axilla is directed towards, right, the neck, which is the posterior triangle of the neck, so the root of the neck, all right? And then we see that the walls of the axilla, we have the posterior wall, a medial wall, right? That is there where you have the costals, and then you have a lateral wall, right, in relation to this bone, an anterior wall, right, in relation to the pectoralis, the pectoral muscles, right, and the posterior wall in relation to the scapula. So that's basically the axilla. So it's used as a pathway from the posterior triangle of the neck to the brachium. All right. So looking at the axilla, let me use my marker. Looking at the axilla, we see that it's basically like that, right? So there we have the pyramid, all right? And viewing from above, it is the medial wall, the posterior wall in relation to the scapula, the lateral wall in relation to the humerus, right? And that groove, right? The bicipital groove, and the anterior wall in relation to some muscles there, all right? So let's start with basically looking at the apex, right? So the inlet, or basically what you call the outlet as well, of the axilla, right, is bordered actually by the clavicle, right? So it's bordered by the clavicle, the lateral parts of the clavicle, and then the posterior wall, or the posterior margin, if I use that, the posterior margin actually of the axilla, right, is in the upper border of the scapula. And then medially, we have the outer border of the first rib. So get that, the outer border of the first rib, all right? So we're saying that the apex actually of the axilla, you have the clavicle, right? The lateral parts of the clavicle, and the first border of the first rib, right? The outer border actually of the first rib, this outer border, right? Get that, the outer border. And then you have then the upper border of the scapula. So that forms the apex actually of the axilla, right? Then looking at the medial wall, the medial wall is formed by the serratus anterior muscle, right? So the serratus anterior, remember, it actually originates actually from the thoracic wall. So it originates from the thoracic wall. So at this point, we are basically reaching to the fourth rib, right? So the serratus anterior from rib number 1 up to the fourth rib, right? And then, so medially, just remember we have the serratus anterior. And then the anterior wall, right, is formed by the pec muscles, so the pectoralis major, the pectoralis minor, and a fascia that we call the clavipectoral fascia, right? So the pectoralis major, the pectoralis minor, and the clavipectoral fascia. The clavipectoral fascia is the fascia that actually encloses the pectoralis minor, right? So the clavipectoral fascia encloses the pectoral minor and also acts as a division between the pectoral region and the axilla. So anterior with the pec major, pec minor, and the clavipectoral fascia. So that is the anterior wall. Going to the lateral wall. So the lateral wall of all the walls, right? The lateral wall is the one that is actually narrow, right? So the lateral wall has got the intertubercular groove, or what called the bicipital groove. So you can actually appreciate that with the tendon of the biceps, right? So that one, as well as with the biceps tendon, right? So there we have the intertubercular groove, right? With the long head of the biceps, right? Then there we have the clavipectoral fascia enclosing the pec minor, right? And also separating the axilla from the pectoral region. And then there we have the pectoralis major, right? And there we have the serratus anterior to the rib number 4, right? Then, so that was the lateral wall. Then the posterior wall is made up of these structures that we have. So muscles actually coming from the scapula going onto the humerus, and some coming from the posterior thoracic wall, right, going as well to the humerus. So if the subscapularis coming from the subscapular fossa, right, the subscapularis coming from the subscapular fossa, and then we have the teres major, right, at that point, and then we have the latissimus dorsi. So you can remember that the subscapularis, teres major, and the latissimus dorsi, that forming the posterior wall. So the muscles that we have at this point anterior to the scapula. Then the floor actually of the axilla, there is actually a fascia actually, right? So there's dense fascia forming the floor of the axilla, right? So we actually see that the axillary fascia actually, which is actually there, is held by ligaments, right? That we call the suspensory ligaments end as well, right? So we see that the floor actually has got anterior extents and posterior extents. So the floor has got an anterior extent, which is called the anterior axillary fold, and then we also have a posterior axillary fold, all right? So that's what we have there. So the floor is basically made up of the axillary fascia, right? Which is actually headed by the suspensory ligament. Are we together? And the floor has got an anterior fold and then a posterior fold. Then lastly, let's look at the contents that we have within the axilla, right? So for the contents that we actually find in the axilla, just with this order, right? This is what you find there. So the long head of the biceps, that's A, can you see A, that point? That's the long head of the biceps. Then B, right, is the latissimus dorsi as well. So these muscles also forming the posterior wall are also considered as well to be within, right? So with the latissimus dorsi and the teres major, right? And then at this point, we have the long thoracic nerve, right? So at this point, we have the long thoracic nerve. So remember the long thoracic nerve coming basically from C5, C6, and C7, long thoracic nerve sliding on the thoracic wall, right? And then we have the axillary vein and the axillary artery, right? So I want you to understand the relation that we are seeing here. So the axillary vein is medial to the axillary artery within the axilla, all right? Then in relation to the axillary artery are 3 cords that are shown there, the cords of the brachial plexus. So remember, within the axilla, we have the cords of the brachial plexus. Before the cords, the branches and the divisions are actually within the neck. So it's the cords and the divisions of the cords that we find within the axilla. So the cords are actually arranged according to their names: the posterior cord, a lateral cord, and a medial cord, all right? Are we together? Then we have a muscle at this point, which is the coracobrachialis, right? And then the short head of the biceps, and then numerous lymph nodes that we find in these regions that we'll discuss later on. So that's it from the apex to the medial wall, to the lateral wall, to the anterior wall, the posterior wall, and the floor, right, of the axilla. And looking at within the axilla, we just focus on these structures of importance, the axillary artery. And like I said, this structure is basically lateral to the axillary vein. So grooving the first rib, you actually see that the groove of the subclavian artery is lateral to the groove of the subclavian vein. Then we say the outer border of the first rib marks the inlet actually to the axilla, right? So within the axilla, we find this large vessel, right? The subclavian artery. And the subclavian artery is divided into 3 parts, right? So the subclavian artery is divided into 3 parts, right? So the first part is from the outer border of the first rib, right? From the outer border of the first rib, right? To the place where it disappears underneath the pectoralis minor, right? So remember, the pectoralis minor is coming from rib number 345. 345 going on to this process at this point, the coracoid process, right? So we actually see that from the outer border of the first rib, right, to the disappearance, actually, that's the first part. And then we have the second part, which is actually the part that lies underneath the pectoralis minor, right? And then the third part that is from this outer border of the pectoralis minor, right, to the lower border of the teres major, right? The lower border of the teres major. Why? Because the teres major forms a posterior boundary actually of the axilla, and also as well forms the lower part of the posterior boundary. So the lower part of the teres major, that's the lower extent as well of the axilla. So the axilla stretches from the outer border of the first rib to the lower border of the teres major. So there we have three parts. So with the three parts, we actually see branches coming from these parts actually. So we have one branch, right, from the first part. Then we have two branches actually from the second part, and then three branches from the third part. That's how simple it is. So looking at that, we have the first branch, which is called the highest thoracic artery. So the first branch is called the highest thoracic artery. So the first branch is called the highest thoracic artery. Are we together? And then that's what comes from the first branch, from the first part of the artery. Then the second part actually gives off two vessels, which is the thoracoacromial, right? So thoracoacromial gives thoracic branches and acromial branches. So that's why it's called the thoracoacromial. And then the lateral thoracic artery, right? So that these ones are actually coming from the second part. So they're actually coming from the second part. This is from the first part, right? And then for the third part, we have the subscapular artery, right? So that's the largest branch, which is the subscapular artery. The subscapular artery going to the subscapular region. Remember the subscapular fossa, where you have the subscapularis, then you have the subscapular artery. And then the third part will then give these two circular arteries, actually, which is the anterior and the posterior circumflex humeral arteries. Anterior and posterior circumflex humeral arteries. Are we together? Good. Then at that point, let's understand that we have this posterior circumflex humeral artery in close relation actually with the axillary nerve. So the axillary nerve moves actually with the posterior circumflex humeral artery, so that in downward dislocation of the humerus, actually see that you damage the posterior circumflex humeral artery as well as the axillary nerve. All right. So those are the branches. So these ones are then coming from the third part. So these ones are coming from the third part, right? And this one also coming from the third part. So that's the revision actually of the axillary artery. Are we together? Then let's appreciate just in this diagram, the axillary vein, right? So the axillary vein, before you form it going upwards, then just reaching the outer border of the first rib, it then becomes a subclavian vein, as well as the artery, just reaching the outer border of the first rib, it changes its name from subclavian artery to the axillary artery, right? So here, what are we seeing? We're actually seeing that this axillary vein is being formed by the basilic vein. It's being formed by the basilic vein, right? So remember the basilic vein, which drains the medial aspects of the upper limb, the basilic vein, and joining with the vena comitante of the brachial artery. So the veins that move with the arteries, we call them the vena comitante. So the joining then forms the axillary vein. So we can actually say the axillary vein is a continuation actually of the basilic vein. Right. So then looking at that, the basic relation that we need to understand concerning the artery is the presence of many lymph nodes, right, and the vein and the nerves within the axilla. So also I've got fat actually within the axilla there. So looking at this artery there, you then appreciate that we have the cords of the brachial plexus, right, arranged, right, according to their names. So you actually be having the posterior cord posterior to the artery, right? And that part of the artery which has got those relations with the cords is the second part of the artery, right? So I actually say the first part of the axillary artery, right, in relation to the cords of the brachial plexus, right? We say the cords of the brachial plexus are actually lateral, right, and superior. So they are actually superolateral to the artery, right? So the cords of the brachial plexus are actually superolateral to the artery, right, in the first part. Then the second part, we actually see that the cords are then arranged according to their names. So that the medial cord is medial to the artery, the posterior, the lateral cord is lateral. Are we together, right? And then from there, the third part has got many relations that actually vary with the branches that are actually coming from these the branches of the cords, actually, right? Then we say that the axillary vein is always medial, actually. The axillary vein is medial to the axillary artery. Then the axillary artery and the cords of the brachial plexus actually will be covered by a sheath that we call the axillary sheath. So they'll be covered by a sheath, which is the axillary sheath. Are we together? So they pull this sheath together when they're actually coming from the neck. Right, then with the lymph nodes that we have within the axilla, so within the axilla, it's really a place where you actually see these rich lymph nodes, actually. So within the axilla, we actually see a group of lymph nodes, right? And the mnemonic that we actually use for those ones is also the word for another group, which is basically apical, right? Which is basically apical. So here, let's appreciate that we have the apical group, yes, being group number 1. So we have the apical group, which is basically group number 1. And then we have the anterior group, right? We have the anterior group of lymph nodes. And then we have the posterior group of lymph nodes, right? And then we have the lateral group of lymph nodes, right? We have the lateral group of lymph nodes at this point, right? So there is the posterior group of lymph nodes, and then lateral group of lymph nodes. And then we have the central group of lymph nodes embedded within the fat, right? So that's basically that. So the lateral group is basically in relation with the axillary vein, the central group in relation with the fat that I actually see within the axilla vein. All right. So then we have the anterior group that is located at the lower border of the pectoralis minor there. All right. So I'll basically talk about how lymph actually moves within these nodes. So lymph will actually be ascending upwards. So lymph that is being received from various areas of the body reaches the lateral group, the posterior group, and the anterior group, all right? And the anterior group. There's another group that I'll talk about, which is the infraclavicular, but for now, let me focus on this one. So we can actually safely say the anterior group, right, drains the anterior abdominal wall, right, and the anterior thoracic wall generally, right, above the level of the umbilicus. So above the level of the umbilicus, there you have lymph being drained from the anterior abdominal wall, anterior thoracic wall as well, by this anterior group of lymph nodes. They also drain the breast. So they drain the lateral quadrants of the breast, draining about 75% of the lymph actually into them. Then we have the posterior group. So the posterior group is obviously draining the posterior abdominal wall or the posterior body wall above the level of the iliac crest. So this is above the level of the iliac crest, above the level of the umbilicus. That's the posterior group. Then we have the lateral group. So the lateral group generally drains the upper limb. So the lateral group basically drains the upper limb. But I want you to understand that the lateral group drains the medial aspect of the upper limb. So the lateral group drains the medial, right? Isn't that cool? So we have got medial parts of the upper limb draining into the lateral group. So the medial aspects of the upper limb draining into the lateral group. So they also receive from nodes that are called the supratrochlear nodes that we find in relation to the medial epicondyle actually of the humerus. So from the supratrochlear nodes, right, and also nodes that, and also lymph vessels coming and draining the medial aspects of the upper limb, they go to the lateral group. Then this whole lymph, right, that has been collected in the nodes, then ascend upwards and then is then given to the central group. Then the central group will then give to the apical group. Then the apical group will then give to the infraclavicular nodes. So the infraclavicular nodes, strictly speaking, yes, functionally they work with the axillary nodes, but anatomically they're not actually located within the axilla. So we actually group them, yes, with the axillary nodes, but actually they're not located within the axilla. So going back to the mnemonic, we say the apical, A stands for the apical, the actual apical, right? The apical group. P is for the posterior. I is for the infraclavicular. C is for the central, right? A is for the anterior group. L is for the lateral. There we have the apical. So you remember that. So that's with the axilla. Now let's talk about the mammary gland, the breast. So this is an accessory gland of the skin. So it's basically an accessory gland of the skin, and it develops actually from ectoderm. So remember that it actually develops from endoderm. And then about on the age of puberty, actually you actually start to see the differences between the males and the females. All right. So the breast, actually, we actually say that the base of the breast, right? So the breast has a base, and then the nipple that is actually surrounded by a darkened area that is the areolar region, right? So the base of the breast stretches actually from rib number 2, right, to rib number 6, all right? So rib number 2 to rib number 6, that is the base actually, right? So remember that. Rib number 2 to rib number 6, that's the base of the axilla, right? Then the level of the nipple is the 4th intercostal space, right? In males, in females, we haven't reached puberty, right? But in females above the age of puberty, actually the nipple then varies in extent. So we're saying the nipple is within the 4th intercostal space within the males. The base is 2nd rib, not 2nd intercostal space, the 2nd rib to the 6th rib. So remember that, all right? Then the extent of the breast horizontally, you actually see that it's actually be stretching from the parasternal region, so from the lateral margins of the sternum. So if you can look at that, there we have the sternum, so actually be stretching from the lateral margins of the sternum, right? And there is a variation in extent of its extent laterally, but commonly extends into the mid-axillary line. So remember the mid-axillary line, not the anterior axillary line or the mid-clavicular, don't be confused. It's the mid-axillary line, all right? So that becomes then the extent of the breast, all right? So anyway, that is it concerning the breast. Then we then see that the breast get blood supply from different sources actually, right? And then the veins also will actually correspond to the arteries. So for blood supply of the breast, we have supply that is coming from this vessel, and if you can remember that from your thorax, that is the internal thoracic artery. So the internal thoracic artery then gives these branches, the perforating branches that supply the medial quadrants of the breast. That's number one. Number two, we also have got vessels that are actually coming as well, perforating from the intercostal, the posterior intercostal arteries. But largely, we want to talk about the blood supply that actually be coming from the second part, the blood supply that actually be coming from the second part of the axillary artery. So remember, the thoracoacromial and the lateral thoracic supply the breast. So two vessels coming from the second part of the axillary artery, perforating branches from the internal thoracic, and other branches that are actually coming from the intercostal arteries, right? That is the supply of the breast. And I said the veins actually then correspond to the arteries. Then interestingly is the lymph, right? So for the lymph, because this is a region for cancer actually. So you see that the breast is then divided into quadrants. So the breast is then divided into quadrants, right? So quadrant, that means we have 4 regions, right? So divided into quadrants. So we have the upper outer quadrant, the upper medial, the lower outer, the lower inner quadrant. So I want you to appreciate this region that I'm actually shading there in red. This is the region that is most prone, right, to cancer, right? So carcinomas, the upper outer quadrants is prone to that actually. All right, then let's appreciate that for lymph drainage actually of that structure, we actually see that the lymph corresponds as well to where we were getting the blood supply. Then I'll also explain to other regions as well. So we find lymph going to the lymph nodes that will be moving along the internal thoracic artery. So we find the internal thoracic nodes actually. So the internal thoracic nodes draining the medial quadrants as well, right? Then we actually see that some nodes then ascend upwards, right, draining into some aggregations of lymph nodes there in the pectoral region. Then we then see that 70% almost of the lymph from the lateral quadrants is, or 70% of the lymph of the breast actually, in the lateral quadrants is going to the anterior group of lymph nodes. So remember the anterior group of lymph nodes that I say is related on the lower border of the pectoralis minor, right? That is the lymph drainage actually of the breast. But if you block one of these major drainages, you may actually see that lymph can actually flow to the abdominal region or can actually flow to the opposite breast. All right, so lymph can actually flow to the opposite breast if you cut the major drainages. All right. Then looking at the this mammary gland, so we said it's an accessory gland of the skin, yes. And then within it, actually, we then find glands, right, that produce milk. All right, so we find glands that produce milk, right? So if the alveolar glands that we find within that, right? And they are actually septa, so there's actually fibrous septa that will actually be extending, right? So a fibrous septa that actually be extending into the gland, dividing the gland into lobules actually. So that fibrous septa also acts by anchoring the mammary gland actually to the deep fascia that we have underneath the mammary gland. So those are called the suspensory ligaments actually of the mammary gland. Are we together? Then the mammary gland will give a tail, right? This that tail that moves on to fuse actually with the deep fascia that you actually find within the axilla. All right. So remember that. Then you see that between the mammary gland and the pectoralis major, actually, there is space that actually called the retromammary space. So remember, there is space between the mammary gland and the pectoralis major. Right, so kindly note that mammary gland extends from reed number 2 to reed number 6, and the nipple in males and females who haven't reached puberty, it's at the 4th intercostal space, and then blood supply is coming from the intercostal vessels, and also, like I said, also perforating vessels are actually coming from the internal thoracic artery, and then the second part of the axillary artery giving the lateral thoracic and the thoracoacromial artery. So they also give mammary branches. Then 75% of the lymph is actually into the anterior pectoral group of lymph nodes, and carcinomas are commonly in the upper outer quadrant of the breast. And now let's talk about the cubital fossa. So the cubital fossa is an important landmark that you actually find on the anterior aspects actually of the joint, which is the elbow joint. So the cubital fossa, find it at the anterior surfaces actually of the elbow joint. Then looking at that, we then see that one thing you need to note is the boundaries actually of the cubital fossa. So the cubital fossa is bounded medially by the pronator teres. So it's bounded medially by the pronator teres. If you want to remember that, pronator teres is the muscle of the anterior compartment. And the medial epicondyle, that's where we have the common, right, tendon for the flexors, right? So obviously the pronator teres is coming from medial, right? Then laterally, we have the brachioradialis coming from the lateral supraepicondylar ridge, right? So there we have the brachioradialis. Then the base actually, right, is formed by an imaginary line that you draw between the two epicondyles. Then that's the cubital fossa. Right, so looking at the cubital fossa, you actually see that here we have the brachioradialis, right? So looking at the cubital fossa, we have the brachioradialis at this point, the pronator teres at that point, right? And then looking at the roof, we see that we have an aponeurosis that is actually coming from the biceps. That is called the bicipital aponeurosis. So it reinforces actually the medial aspects of the roof, right? And then appreciating that the flow actually of the axilla, so the flow of the axilla is formed by these muscles. So we have medially, we have the brachialis, and then laterally, we have the supinator. All right, so medially we have the brachialis forming the flow, and then laterally we have the supinator. Then the contents, like we know commonly, from medial is the median nerve, followed by the brachial artery bifurcating, and then the tendon of the biceps, right? The tendon of the biceps, and then the radial nerve. So our common mnemonic, my boy, the bifurcation, tengai, which is the tendon, razor. So my boy, tengai, razor, for the contents actually that we find there. Then superficially, on the roof, we find veins, actually, the cubital veins. So actually find cubital veins on the roof, and also some nerves that we find as well at the roof, all right? Like the musculocutaneous nerve, we also find it at the roof there, right? And also in the roof, on the roof, right, superiorly, we actually find a group of lymph nodes that we call the supratrochlear group of lymph nodes. That I said, they direct their lymph into the lateral group of the axillary nodes. All right, so that's basically about the cubital fossa. Let's talk about the anatomical snuff box. box, so the anatomical snuff box that we find in this region, you need to understand the borders as well and the contents actually that we find there. So for the borders, we have this one tendon medially and the two tendons laterally. So we have the one tendon medially and the two tendons laterally. So that one tendon is the extensor, is found on the extensor compartment. Pollicis is of the pollicis longus. So the extensor pollicis longus tendon. Then here on the lateral, we find the extensor pollicis brevis. So it's brevis, the short one, right? So we say the long one is on its own, then the short one is here. Since this one is short, we can then say, since it's short, it needs a friend. The friend here is the abductor pollicis longus. So the abductor pollicis longus. So the abductor pollicis brevis is actually a small muscle of the hand, so we don't expect it there. All right. So we've got two longus and one brevis, right? Two extensors and one abductor, right? So we find these structures labeled here in this anatomical snuff box, which is the cephalic vein, passes through that, and as well the radial artery. So you can also get the pulsations actually of the radial artery there. Right, so that's it. So looking at that, we then see that we have this extensor pollicis longus, right? And here we have the extensor pollicis brevis, right? And the abductor pollicis longus, right? And the structures that pass through that, we appreciated the cephalic vein passing superficially, and deep to that, these tendons, we then find the radial artery. Are we together? And then passing there, also superficially, is this nerve, which is basically the superficial branch of the radial nerve, right, going to supply the dorsum of the hand. And then the bones that we actually see there within the anatomical snuff box, we actually see that we have the scaphoid and the trapezium. So the scaphoid and the trapezium forming the floor of the anatomical snuff box as well. All right. So that's everything you need to understand and appreciate there. So you can take the pulsations of that vessel, or you can take it before it's actually closed by these two tendons at that side. Right. So that's basically that. And one of the things I want you to understand is that we have relations actually of nerves going to the hand, and as well as the blood vessels. So looking at this, I'm interested in just the ulnar artery and the nerve, the radial artery and the radial nerve, right? So I want you to understand that the artery, right, the two arteries are enclosed within a nerve. So if you have an ulnar nerve there, we'll be having a radial nerve at this point, right? So if you understand in the anatomical position, this is medial and this is lateral. So if there be questions asking you, right, now you know that the arteries are enclosed, right, by the nerves on the anterior aspects of the forearm. So at the region of the wrist. So we then understand that we have the ulnar nerve medial to the ulnar artery, right? That's true, right? Or the ulnar artery lateral to the ulnar nerve, that's true. And then here we have the radial artery medial to the radial nerve, the superficial branch of the radial nerve, that's true, right? Or you can say the superficial branch of the radial nerve, or the radial nerve is lateral to the radial artery, that's true as well. So remember, the arteries are enclosed by the nerves. So like I'm saying, at this point, you have that artery, you have this artery, you have the nerve, the radial nerve, you have here the ulnar nerve, and this is the median nerve. All right, this is the median nerve. I will talk about this nerve when we talk about the carpal tunnel syndrome, right? So that's basically that concerning the landmarks that we find in the region of the upper limb. So let me basically discuss what is really happening at this point. So looking at that, we are seeing the median nerve. So the median nerve will enter within the tunnel, right? The carpal tunnel. So it will enter into the carpal tunnel deep to the bend retinacular, right? The flexor retinacular, right? But before it enters into the tunnel, the median nerve will give this branch. It's a superficial branch. It's actually a cutaneous branch. So this branch, it's a palmar branch. So it's called the superficial palmar branch of the median nerve, right? And what this nerve will do is the nerve will supply the palm of the hand, all right? So the nerve will basically supply the palm. So when I say palm, let me try and draw. I hope I get this well in my drawing. Okay, so if I can try and draw that. so that I explain the carpal tunnel syndrome very well, right? So there we go. Anyway, that's my humble hand. All right, so there we go. So that's the palm, right? And there is the retinaculum, right? So we're saying that this nerve that is being given before it passes through that tunnel supplies the palm. So when I mean the palm, not the digits, the palm. So this nerve supplies the lateral two-thirds of the palm. So if you're standing in the anatomical position, remember this digit is lateral, right? So supplying the lateral two-thirds, right? So this is the small digit anyway. So supplying the lateral two-thirds of the palm, right? Then the median nerve, when it gets into the hand, so when the median nerve gets into the hand, this is what it will do. The median nerve would then give a superficial branch, a cutaneous branch, that is now called a digital, right? That is now called a digital branch, right? So this superficial, right, digital, right, cutaneous is basically going to be supplying the digits and their nail beds, right? So that is going to be supplying the digits in there and their nail beds, right? So it supplies 1, 2, 3.5. So the lateral 3.5 digits. So supplying the lateral 3.5 digits. So all of this area, right? Good. Such that if you have carpal tunnel syndrome, so if you damage the median nerve within the carpal tunnel, what I want you to understand is that you will lose sensation in the lateral 3.5 digits and their nail beds, right? So you can lose sensation there, or there can be funny sensations like paresthesia, right? The needle-like sensations, right? Those are the regions that will be affected. So 1, 2, 3, and the nail beds. You will not affect this part, right? So you not affect the palm. So the palm of the hand is actually spared, right? But the palmar aspects of the digits, right? The palmar aspects of the digits are actually affected. Are we together? Right. Such that someone with carpal tunnel syndrome, if you touch them here, they'll tell you, I can feel. Yes, I can actually feel, right? And then if you extend to this region, they'll tell you, I no longer feel. Why? Because the branch there came from the median nerve, which passed through the tunnel where you had this lesion, the lesion at that point. Are we together? So that's basically carpal tunnel syndrome. So we have discussed the landmarks that you guys need to know and understand and appreciate when it comes to the upper limb, right? So I hope you got it very well. So that's what we have today, all right? So that's